Mr. Chairman, Jim Perdue, Jr., members of the committee, I'm president of the Texas Trial Lawyers Association, and we are here in favor of House Bill 621. This bill has a relatively simple effort in its enacting language. The relevant, really, meat of it is on page 4 from line 4 through 10. This is a bill that, from our perspective, is good for both patients, patient access, and healthcare providers. Because all the bill simply tries to achieve is that when you look to the plan, to be clear, this is not a bill that's a mandate to a provider. This is a bill that is a mandate to a third-party payor health insurance plan as defined in the enacting, in the definitional and the applicability. To state that a plan cannot deny or delay payment to the provider simply because they think that there may be a third-party indemnity claim. So the concrete way that works is you either have a provider who is concerned about providing care to somebody because of the possibility of third-party indemnity, specifically as referenced in 1032, motor vehicle accident, and that provider, either because of their personal concern about getting reimbursed by the plan, the eligible plan, or the plan itself delays payment because they think they can access a third-party indemnity claim through their subrogation clause in the plan. So all this bill does is, for both provider and patient who is insured, assures that the provider will get paid by the plan, and therefore the patient will have access to the health care that they are entitled to under their health insurance plan. It's a very narrow addressing of, Chairman, as you've recognized, a much broader conversation that's going on. But one piece specifically in this bill that we think is relevant to the plan. Because I will say, on behalf of the Texas Trial Lawyers Association, despite some allegations, we are in favor of patients who happen to have been victims in motor vehicle accidents or elsewhere to have access to their health insurance, not to be outside that system. So thank you for your time.
Jim, in your experience or experience of your members, so I've heard from stakeholders that have said that this doesn't happen very often for insured patients, that the real problem is people who are uninsured or people who are on Medicaid or something like that. Can you comment on that with respect to your practice and your members? Is this a thing that you see a lot where a carrier would refuse to cover a claim? Or
So, Chairman, you and I both, I've enjoyed your request for data, and I wish I could provide you actual statistics on something like that, but unfortunately I'll default to anecdotal.
Okay.
As you know, Medicare and Medicaid both enjoy secondary payer status if there's a third-party indemnity claim. So they move into a different status altogether and don't even need to pay the provider because they move into a secondary payer status. Most private plans, like a Cigna or United Healthcare, don't necessarily move into a secondary payer status, but they enjoy a subrogation right against the indemnity claim. And anecdotally, what we understand that leads to, and many members report, is somebody goes to a provider who is on the list, and the provider either says, well, I don't want to get involved in this because there's litigation. That's one issue. Or they say, I'm going to get slow paid by the plan because they know they can look to the subrogation right, not necessarily move into secondary payer. I don't want to make that insinuation. I think that's what the plans say. But anecdotally, what they do then is the provider or the office itself has a failure to get reimbursed in a timely passage. And so and I don't have real statistics on that, but that certainly has been my personal experience, and that's a report from a wide swath of our membership and what this is seeking to fix.
I appreciate you trying to answer that. Members, any questions for Mr. Perdue? Yeah, Representative Paul.
I had a few things here while you were testifying. Are you saying that individuals are being denied health care?
No. I think that, unfortunately, they are seeking health care, and there are providers who do not provide it to them through their health insurance plan and therefore they can't get access to the care.
Well, that's the same. So you said that somebody's injured in an accident and they can't get treated.
Yes, sir.
So how are they injured and can't get treated? Isn't you have to get treated if somebody's injured?
Well, if you were in an emergency situation, obviously you're subject to TTLA and you have a right there. But say you have an accident and you go then to first primary care provider 2 days later, and you're complaining of something, and now you're in what you have access to. The effort to try to explain is there's a lot of victims, that is claimants, who report they can't get access to the people on their health insurance plans. They just don't treat them because of the challenges they get in getting reimbursed.
I mean, I don't know if you can. I don't know any health plan that or any health insurance that doesn't pay for you if you have an issue, or at least you get treated, and then you might have to argue about the bill later.
Well, this isn't.
The other thing would be then if these people, if you're saying that the health plans have to pay, then would they have to go sue these other insurance companies to try to get their money? Or if somebody else had a wreck and then you were supposed to be taken care of by your auto insurance, now you're saying that, no, you're going to force somebody else to do that coverage, how would they ever get their money back? They will have to go sue these auto insurance companies?
Well, there's two aspects to that. Is if the indemnity language, I mean, this is Texas Supreme Court law, the indemnity language that exists in everybody's health insurance plan that they have is contractual. It's an absolute right. So if there is a third-party claim by the person who was hurt and they get any recovery, that contractual right obligates them to repay the plan themselves. And I deal with that a whole lot. If they don't seek indemnity through a third-party claim, the insurance company has its own independent right to seek that because they subrogate into the seat of the patient for purposes of recollecting the health care they paid for. So either way, I think your question is, are you saying they have to go sue for it?
So basically what I'm saying is that cost, that effort, and all that, they have to go through there when it should have been somebody else's burden to pay already in the first place.
Well, but the health plan has their obligation to pay under the terms of the plan. That's why.
And if you're saying you want to make sure that they pay because the auto insurance company's not paid, that's the example that you gave. That's why I mentioned accident and not getting injured. I'm just following on your example that you're saying if somebody was in an auto accident and then they didn't get paid, the insurance or the auto insurance was refusing to pay, that the health insurance had to pay. I'm trying to figure out what would be the ramifications of that.
Let me try to back up. The auto insurance has no obligation to pay directly for a health insurance of an insured individual.
They'd have to pay for their injuries.
No, they have to pay for their injuries, which includes an element of damages for medical expenses. If a claimant then recovers any money for the medical expenses that their health insurance plan has paid, then the claimant under their contract has to pay the health insurance plan that money.
So what is the individual out? What do you need this legislation for?
What this does is it allows a system that mandates that the plan can't deny the provider the reimbursement for services, thus assuring the provider that they're going to get paid. And that way you have access to the medical care.
Yeah, you're saying they can't deny that care because it's supposed to be covered by somebody else.
It's not supposed to be covered by somebody else. It's recoverable from somebody else if it has been paid. That's
your word, my word, meaning the same thing. That's what I'm saying. They're eligible. They're required to make that payment.
Just so I really apologize that I'm talking, and I don't mean to. With all respect, a third-party car insurance policy, a claim against a car insurance, has no obligation to pay a provider.
But that's what you're saying that this does.
No, this says the plan that the beneficiary is under must pay the provider.
All right. But they're always going to pay if there's a reason for a health care need, they pay. You're saying that the reason that your example that you gave earlier is if they wanted to make sure that you're trying to make sure that the health plans pay when they don't want to pay because somebody else is liable to pay. This third-party person should pay.
They don't want to pay because there's a variety of issues that are raised that I hear. The delay of payment, the person's
delaying payment.
the health insurance plan.
Why are they delaying payment?
Because they know that at some point in time they have a contractual right for indemnity.
Indemnity, why?
Because the health insurance plan that they have says that they can indemnify against a recovery for medical expenses that they've paid for that were recovered in a third-party liability claim.
Yeah, because there's third-party payer. That's what I keep saying. It's all right. I think I'm talking over your head, and it's too late for that. The last thing I want to ask you is, you said that Medicaid and Medicare already have their second payer. They wouldn't have to ever pay this.
So Medicaid and Medicare enjoy secondary payer status if there's a third-party liability claim. They both have a practice of go ahead and paying the claim, but they then get the same indemnity through a federal super lien.
Would this be something that you would be requiring somebody to do that Medicare and Medicaid don't have to do?
No, not at all.
Okay, thanks.
Members, any other questions for Mr. Perdue? Jim, thank you for being up here with us. Appreciate
Thank you. I appreciate it.
This time the chair calls Ms. Lori Van Hoos.